Welcome to REM Award, the podcast that explores the secrets of sleep and psychology. I'm your host, Ryan, and in each episode, we'll dive deep into the world of sleep and other topics such as mental well-being and personal growth. If you want to unlock your full potential and receive the rewards that come with understanding the power of sleep, you're in the right place. To discover more tips and insights on improving your sleep and overall well-being, visit our website and explore our other episodes at remaward.org. Dr. Jennifer L. Martin is a clinical psychologist, professor of medicine at the David Geffen School of Medicine at UCLA, and a nationally recognized expert in sleep science. With a PhD in clinical psychology and extensive training in geriatrics, Dr. Martin's research focuses on improving sleep to enhance physical and mental health, particularly among women and older adults. She has made significant contributions to the development and dissemination of cognitive behavioral therapy for insomnia, or CBTI, through her work with the VA Greater Los Angeles healthcare system. As a board member of the American Academy of Sleep Medicine and a dedicated researcher, Dr. Martin's work bridges the gap between clinical practice and innovative sleep research. Her focus on how sleep impacts chronic diseases, mental health, and overall well-being makes her a leading voice in the field. We're thrilled to have her on the podcast to share insights that are not only groundbreaking, but also deeply practical for anyone looking to improve their sleep and health. Alrighty. So yeah, first I wanted to talk to you about, how sleep and health is affected by public policy, such as with daylight savings times, which is implemented throughout most of the US. So what are your thoughts on the debate over, a permanent daylight savings time versus standard time, especially in regions where it really remains dark until, late in the morning sometimes?
So there's really pretty unequivocal evidence, meaning scientists agree across a number of studies, that when we are on standard time, the rising and setting of the sun aligns best with our biology and how we function. And the reason for that is what you just suggested. It's because of when daylight hours occur. Daylight savings time isn't really what we should call it because it doesn't actually save any daylight hours. A day is 24 hours, and the number of hours that the sun is up is identical. It's just how they align with the clock on the wall. And again, for the vast majority of the United States, where we change our clocks twice a year, when we switch from standard time to daylight time, the rising and setting of the sun isn't as well aligned with our internal clocks. So again, public health experts and medical organizations, the American Academy of Pediatrics, a lot of professional organizations and a number of scientists think that we should just be on permanent standard time. Because that, again, is better for our health. And as you mentioned, darkness in the morning, it's also better for safety, for traffic accidents in the morning and things like that.
Got it. That makes a lot of sense. Yeah. And I guess switching gears here, is there a relationship between, do you see sleep disorders and public health, particularly how, untreated sleep disorders can affect a broader community health outcomes?
Yeah, one of the big issues that comes up is that a lot of people with sleep disorders are sleepy during the day.
Okay.
And what that sleepiness does is it increases their risk for accidents and injuries. So you can think about somebody maybe who's a truck driver who has sleep apnea, or they snore and they can't breathe while they're asleep. Well, having that untreated sleep disorder can have a public health effect because it can increase risk of that driver having accidents, whether they actually cause the accident themselves or the reaction time just isn't as fast because they're sleepy. The other example is actually in athletes. So athletes who don't sleep well or don't sleep enough because they have sleep disorders perform less well and are at higher risk for injuries. So there's been actually, for example, in the National Football League, more and more attention paid to disorders like sleep apnea because players with untreated sleep disorders are more likely to end up getting injured or to have other conditions that prevent them from playing.
Got it. Yeah. Super happy to hear that. Yeah. And I guess when someone is struggling with sleep issues, what are the first steps they should take to seek help and improve their sleep quality?
Well, I always think that people should spend as much energy thinking about their sleep as they do about physical activity and exercise and what they eat and drinking enough water. We should think about it like other things we do to take care of ourselves. And in the case of sleep, what that really means is having a structured schedule. That's one of the really important ones. So within reason, you're going to bed and getting up at similar times. A lot of people will tell me, well, I don't want to get up at the same time on the weekend. And I always say, well, that's okay, but maybe within an hour or two, right? Otherwise, you're kind of giving yourself jet lag over the weekend.
For sure, yeah.
But maybe you get up within about an hour of the same time and you go to bed within an hour or two of the same time. That's really important. And then the environment where you sleep should be a place where sleep can happen naturally. So it should be comfortable in terms of where you're sleeping. It should be quiet. It should be dark. And it should be, a cool temperature. So those are the kind of environmental things. And then the third thing is you have to get into bed with the right mindset. So if you get into bed and you try really, really hard to fall asleep, it will keep you awake. If you get into bed and you have 100 things going on in your head because you were just, doom scrolling on social media, or maybe you were watching the election news, or you were watching a zombie movie, it's very hard for your brain to kind of wind down.
Right.
So what is more helpful is if you do things that kind of put the day to rest. So, it doesn't have to be a long or complicated routine, but kind of have something that you do in the last, say, 20, 30 minutes before you get into bed that just kind of allows your mind to disconnect from the day. Exactly what that is varies from person to person, maybe listening to music or writing in a journal or reading something. Again, something that just kind of lets your mind be at ease when you get into bed. And then there's two other things that I'll add. One is caffeine keeps people awake. It's the mechanism is very well understood. It acts on the system in your brain that causes you to feel sleepy. So it blocks the action of adenosine. It takes about 5 hours for you to metabolize 50% of the caffeine that you ingest.
Wow.
So for young people, that means you really shouldn't have any caffeine within 5 hours of when you want to go to bed. Some people are more sensitive and they have to get almost all of it out of their system. So a lot of people have heard like, oh, you shouldn't have caffeine after lunch. Well, really that's kind of because it's about 10 hours before most people go to bed. By then, almost all the caffeine is out of your system. So that's something to keep in mind. And then, other substances and drugs like nicotine, alcohol, marijuana, all of them have a negative impact on the quality of the sleep that you get. So even if they help you feel relaxed and sleepy, if we measure the kinds of sleep, the different sleep stages, it doesn't look normal when you're actually asleep. So those are the things to keep in mind.
Got it. Yeah, that makes a lot of sense. Like, I feel like a lot of people overlook sleep quality and think about like just how long they're sleeping.
Yeah.
Definitely an
Yeah,
important
it's
factor.
true. And imagine if you just sleep better, it's like way more efficient. You could be in bed for 10 hours and sleep poorly, or you could be in bed for 8 hours and sleep great. And the 8 hours is way more efficient. You have 2 more hours to do fun things during the day.
For sure. Yeah, I like that mindset. Yeah. And then also I was curious if you've seen this, like, have you seen like, I guess like how cultural attitudes maybe towards sleep and health influence, I guess, the treatment and management of sleep disorders in, I guess, like different populations or areas?
Yeah, so there are definitely cultural differences in the attitudes that people have about sleep. There are some cultures where sleep is viewed as kind of like a luxury. And you think
Mhm.
about cultures where people take siesta, everyone goes home in the middle of the day, they take a nap, and then they go back and work in the late afternoon or early evening. And then there are cultures where people are super driven and sleep is viewed as a weakness as opposed
Mhm.
to a biological necessity. I think within the US, one of the big areas where we see differences across culture is in how people treat the sleep of their kids. So, how much value do they place on making sure that their kids are getting a decent night of sleep? Or what are they modeling at home for their kids in terms of how important sleep might be?
Yeah. Okay, got it. Um, and then I guess so like what are some of the like common barriers to, I guess, assessing effective accessing like effective sleep treatments, and how can these like
Yeah.
barriers be overcome?
Well, the first thing that's a problem is that there's all kinds of bad information out there online. The most common one is like, take this supplement. This supplement will fix everything.
For sure.
It won't, I promise. It might work for a little while, but it's mostly just a placebo effect. The other thing is it can be really hard for people to access medical professionals who treat sleep disorders. Um, and the advice that I usually give people is to be really clear with your doctor what you need. So if you go to your doctor and say, I'm really struggling with sleep and I don't want to take a sleeping pill, I want you to give me something else. I want a referral to a specialist. Uh, a lot of there are sleep medicine specialists, physicians, psychologists, nurse practitioners that can be really helpful. But it's not always easy to get there. And of course, for people who don't have insurance, it can be really expensive. Um, but the best way, if you're really struggling with sleep and you've kind of tried these basic things and you can't get it back on track, is to try to get seen by a doctor who specializes in sleep medicine.
Yeah, that makes sense. And I guess going back to like sleep quality. So like how does
Huh?
sleep quality like I guess specifically affect like chronic diseases and like what evidence supports I guess like the link between sleep and conditions like
Yeah.
cardiovascular disease or diabetes or all sorts of like that.
Yeah. So it's really interesting. If you take a normal, healthy person and you cut out half of the one night of sleep, so instead of letting them be in bed for 8 hours, you only let them be in bed for 4 hours. You can see differences in what's called glucose tolerance. So
Hmm.
that's a sign of diabetes. You can see higher levels of inflammation, which is associated with, you know, Alzheimer's disease, cardiovascular disease, all of those things, just from missing half of one night of sleep. You can measure
Wow.
differences in a healthy person. So it's pretty remarkable. On the flip side of that, there's evidence that treating sleep disorders can help with some of these things. So, for example, if you treat someone's sleep apnea, you can improve the level of blood sugar in somebody who might be prone to diabetes. It doesn't seem to so that's one example. Another example is that if you take people who don't get enough sleep and you extend their time in bed so they're getting more sleep, so maybe they go from 6 hours to 7.5 hours, they lose weight, their blood pressure goes down. So I always try to emphasize the good news story that it's not
Right.
like, well, I've already messed myself up, that's it, I'm done. Actually, you can improve markers of your physical health by improving your sleep, treating sleep disorders, making sure you're getting enough sleep, which I guess maybe is something else I should comment on is, when I say enough sleep, what do I mean? Not everyone is exactly the same height and not everyone needs exactly the same number
Hmm.
of hours of sleep. Almost all adults need at least 7 hours to be rested. People under the age of 25 often need more than that. It's developmental. So, you might remember when you were a little kid, you probably slept like 9 hours a night and you took a nap. And then as you got older, you needed a little bit less. But somebody who's age 18 probably still needs at least 8 hours a night. The 7 hours isn't enough.
Yeah,
But if you aren't setting up your schedule so that you can get at least 7 solid hours of sleep a night, that is associated with a lot of bad health outcomes.
for sure.
Um,
Yeah.
Actually shortens your life. There's
Yeah. Wow.
a number of studies that, if you sleep, especially if you only sleep 6 hours a night, but even if you sleep less than seven, that actually you have a shorter survival.
Wow. Okay. Yeah. It really just shows how important sleep is. Yeah.
Yeah,
And
exactly.
I also think it's important how you mentioned it's at least like 8 or like 7. I feel like a lot of people
Yeah.
think that's like the baseline, but that's
Uh-huh.
really just the lowest amount. Yeah.
Yeah. And I mean, some people need more and some people need less. I
Sure.
mean, there's
Yeah.
kind of that bell-shaped curve around it, but it's it's very unusual that somebody can be, sleeping less than 7 hours night after night after night and then not feel sleepy. Or, the other clue that you're not getting enough sleep is you sleep through your alarm, or when you go on vacation, you sleep more. That means you're not getting enough sleep at home.
Yeah. That makes sense. Yeah.
If 6.5 is enough when you go on vacation, whatever you do, it doesn't matter. You always sleep 6.5. So those
Right.
people are very rare.
Yeah. Got it. And then what advice would you give to like a healthcare provider who is looking to incorporate more sleep-focused practices or strategies to their practice?
Um, what the recommendation I give to a healthcare provider is to go learn about sleep, take classes. I mean, I personally think it's really interesting. This is what I do, right? I treat people with sleep disorders,
Right.
but understand how it works, um, and rely on the science. Because again, I think right now we're at a place where there's a lot of misinformation out there.
Sure.
People are making a lot of money off of other people's bad night of sleep right now. So that would be the main advice that I would give healthcare providers, and then take advantage of the people who really specialize in treating people with sleep disorders. There are common sleep disorders. I mentioned sleep apnea, insomnia disorder is also common, but there are some less common sleep disorders too, things like narcolepsy or restless leg syndrome, where a specialist oftentimes is the one to make a diagnosis like that.
Yeah. Got it. Thank you for that. And then in your practice with older patients, you use something called, I guess, like cognitive behavioral therapy for insomnia.
Mhm.
Can you just explain what that is and how
Sure.
it's been like integrated into like VA programs and what makes it so effective?
Yeah. So I've been studying this treatment for people who have chronic insomnia. Chronic insomnia means you have a really hard time sleeping. It happens a lot, like 3 times a week or more. It goes on for months. And because of not sleeping well, you don't feel well or you don't function well during the day. So those are the people that I work with clinically. And that treatment is designed to tackle all of the things that perpetuate insomnia over time. So one example might be that, maybe you got in a car accident and that got your sleep off track. You might have hurt yourself, the stress of getting a new car, all of that, you kind of got your
Right.
sleep off track. And then a lot of people, they just go back to sleeping fine again. But for some people, they don't. They start to develop habits and routines, and maybe they even just start worrying about not getting enough sleep. And then the next thing you know, 6 months have gone by and they hardly ever sleep through the night. So when that happens, what we do in cognitive behavioral therapy is we kind of, we rip off the band-aid and we clean out the infection. So we go back to square one. Like, how much time do you need to be in bed? How much sleep do you need? What are the things that are getting in the way? Maybe you've started, falling asleep watching YouTube videos because you were having a hard time, and then having your phone playing videos all night is waking you up. Or, maybe you started like using a lot of caffeine to stay awake during the day, and now it's not all out of your system by the time you get into bed at night. Or you wake up in the middle of the night and you start stressing out about being awake. And once you're stressed out, forget it, you're not going back to sleep.
Right.
So, what we do in cognitive behavioral therapy for insomnia is we try to tackle all of those things at the same time and come up with a structure and a plan for that a good night's sleep. And every person is a little different. So, some people, maybe they're more night owls and they do better on a little bit later schedule. And maybe to try to cope with their insomnia, they started getting into bed at 8 o'clock at night. Well, if you're kind of a night owl, that's going to be pretty tough to fall asleep. So
Right.
that's kind of the gist of it. It's usually pretty quick. Maybe I work with people for a couple of months. And we have been doing research on the benefits of doing cognitive behavioral therapy for insomnia. And beyond just insomnia itself, it can improve symptoms of things like depression. It makes people feel less anxious.
Mm.
So it has other benefits too, not just sleep.
That's amazing to hear. Yeah.
Yeah.
And then I guess out of curiosity, like, can you describe any like recent advancements or findings in sleep research that have really excited you particularly?
Mm-hmm. So I'm really excited about the incorporation of strategies like meditation and mindfulness into treatment for insomnia, because I think those approaches have other health benefits, especially mental health benefits. So I'm excited to see more and more studies about that. I'm also really excited to see studies that are looking at people who have more than one sleep disorder. So maybe they are shift workers who have sleep apnea, or maybe there's somebody who has to work 3 jobs and doesn't have enough time to get a lot of sleep, and then once they get into bed they also have insomnia. So I'm kind of interested in these more comprehensive approaches where we're not
Right.
sort of putting people into buckets. We're trying to treat all the things about their sleep at the same time. And that's, I think, more commonly the experience that people have, as opposed to you go to the doctor for one thing and they treat that one thing and then you go home. A lot of
For
times
sure,
it's
yeah.
more complicated. So I'm happy to see research on those kinds of things now.
Yeah, let's hear that as well. Yeah. And then how do you see like the future of sleep medicine evolving, like especially with advancement of technology? And I guess I'm really happy to hear the increased public awareness.
Yeah.
Yeah,
So I think that it's an opportunity for sleep medicine as a field, that people are more and more aware of their own sleep. And my experience is that patients are a lot more willing to talk about it. And so I think, and this is what we're seeing, more and more people seeking help, which is a good thing. We actually need more doctors and psychologists to do sleep medicine. So encourage people to consider that as a field, because I think we have a shortage of specialists, and that's a problem. Um, I think the whole wearable technology space is really big in sleep. So, I mean, everything. I mean, I'm wearing my Garmin watch; it measures my sleep. it's not perfect, but it's interesting. There's information I have about my own sleep that I didn't have, 10 years ago. So I think that the wearable world is going to start crossing into medicine more and more. And there even are some devices now that say that they can tell if you have sleep apnea or not.
Really?
How accurate they are or is hard to say, because the threshold for getting approval to do something like that on a consumer device, something you just buy off the shelf at Target, is different from what the threshold that has to be met if it's a medical device. But so I think the challenge that goes with that opportunity is that there's a lot of information and data coming at people, and they don't always know what to do with it. And it's hard sometimes for their doctors to help them figure it out. And it is a moving target. I feel like every year there's a new sleep app device, something to buy for your bedroom, a special light. I mean, it's a big consumer space right now.
Yeah.
But it definitely has raised awareness.
Yeah, I'm really happy about that as well. Yeah. I'm just curious, like on your personal experience, how do you feel like the watch has helped out? Like, do you see it's giving you like data that's been useful, or is it kind of just like a thing you have and it's just there?
Yeah, I didn't get it for that purpose. I didn't get it to
Yeah.
track my sleep. I got it more for exercise
Right.
related things. But um, I will say I'm a good sleeper. I take care of my sleep. Don't trust a sleep doctor who says they don't
Right.
take care of their sleep. But so for me, I am more like believing that I'm a good sleeper, and I look at it and I think, yeah, that looks about right. I think it's
Right.
more of a challenge if you're somebody who's struggling with sleep.
Mhm.
One of the things that wearables can be very helpful for is if you feel like you have a tendency to get sleep deprived and you want to set goals for yourself to get more sleep or spend more time in bed. I think that feedback can be really helpful. For
Right.
me, I feel like, again, I look at my sleep and it looks like normal sleep, which is kind of what I expect. So,
Right. Okay, got
yeah,
it. Yeah, it definitely could be helpful for people who struggle with sleep. I could see that. Yeah.
yep, yeah, right.
And then I guess for my last question, like, do you have anything else you want to mention or something that you want to like our listeners to take away from this episode?
Well, Ryan, I want to thank you for being interested in this topic. I mean, I think it is really important. And there's been nutrition and exercise podcasts out there forever, and everyone listens to them and they think they're going to get healthier. But sleep is, kind of that third pillar of health. And
For
I'm
sure.
I'm really happy that, you've kind of taken this on and you're helping to spread evidence-based and research-based messages. So thank you for that.
Of course, thank you for being here. Yeah. Yeah.
You're welcome, Ryan. Take care.
Thank you for tuning into the Reward Podcast. Before you go, we'd appreciate your support by subscribing, liking, and leaving your thoughts in the comments. Stay tuned for our next podcast, where we will be joined by a special guest speaker to explore even more about the fascinating world of sleep and psychology.